Hello, everyone. Welcome to another Insights from Women Leaders series session. Just a little bit of background on the series. My name is Rola Kaakeh. I am the host for the series, and I will be the one that is speaking to our guest leaders. We launched the series in 2020 to highlight the journeys and contributions of various women leaders who share their insights on a range of topics impacting their industries, our communities, and their role in shaping the future. Our guests have included leaders from various prestigious and reputable institutions from across the globe. Their backgrounds are diverse, their accomplishments many, and the insights and perspectives provided are valuable, have been extremely valuable. The goal is to learn from women thought leaders and decision makers to empower current and future leaders, both men and women, to positively impact organizations and communities. Diversity of thought, experiences, industries, education, and training is important to us as it highlights the mosaic of perspectives represented in different settings that drive decision-making and positive change. I will have about a 40-minute conversation with our guest leader, structured using questions we've traditionally asked our guest leaders. We ask the leaders similar questions throughout the series. This is intentional, as it allows you to see the differences in responses and lived experiences. After that, I ask questions sent to us from the public prior to the session. So if you ever want to ask any of the guest leader questions, you can submit those on our website. So now it's time to welcome our guest leader today, Karin Källander. She is a senior health advisor and chief of the Digital Health and Innovation Systems Unit at UNICEF Health Programme. She's the co-founder and UNICEF lead of the COVID-19 Digital Health Center of Excellence, a UNICEF-WHO co-led mechanism to deliver agile and coordinated technical assistance to national governments on sustainable and scalable deployment of mature digital health solutions that address health priorities in the context of the COVID recovery and post-pandemic health system needs. She's a specialist in childhood pneumonia, digital health, and health systems research, as well as community-based primary care. She lived 8 years in Uganda, working for NGOs and in academia, and is currently associate professor in the Department of Global Health at the, so is that going to be pronounced the same? Is it the
Karolinska?
Karolinska, yeah. I saw the K and then I was like, oh, it's probably Karolinska Institute in Sweden. So welcome. I am so excited for this conversation. And so we are very, very happy to have you here. And thank you for taking the time.
Thanks for having me.
Okay, so we're going to dive in right away with the question. So a question that we ask all of our guest leaders, the first one, especially after we go through bios, is, did you expect to be where you are today?
Absolutely not. I think if anyone asked me 3 years ago, maybe a little bit longer, 5 years ago, if I knew where I was going to be in 5 years' time, I would not have guessed sitting here in New York working for UNICEF. And I think that's always been the case for me, that I feel like every turn that I've taken in my professional career has been sort of a fortunate slip on a banana peel. And yeah, it was never really a planned path. I've always just trusted my gut feeling when options have come up. Oftentimes, it's been very difficult choices to make. I even went as far once to develop a very sophisticated decision matrix to be able to make the decision whether I should choose, this fork in the road or the other, which I've developed over time. It's become a very complex framework now. I should probably copyright it and sell it to some people. But I still use it actually when I need to take a decision on whether to try to jump on something new or to stay in place. So yeah, I guess no is the short answer. I did not expect to be here. But on the other hand, that's what I love about life in general, is you can never predict what's coming your way. And that's what makes it all exciting.
So that's actually, now I'm curious, because if you're the unpredictability of it, did it make you, this is kind of given in your own nature, want to kind of create, so has that matrix been created just throughout your career, or recently because you're just like, I need a system to all of this unpredictableness? Or like, how have you kind of found, because it seems like that either was created or maybe was it guided kind of, or you use that matrix regardless of the uncertainty?
I think it was because of the uncertainty, because you always know what you have, but you don't know what you're stepping into something new. And the matrix I developed, actually first with a very close friend of mine, was more on a personal level, like a life side of the decision. But it weighted life work topics in a very sophisticated way. And of course, you always still have to guess what life and work will be like in a new location, but it took into some factors that I was aware of, both professionally and socially. It takes in things like social networks, security, social security, family, but it also weights it with the experience I would get from the job. The salary is very low rated on my end, but things like impact, inspiration. So it's a mix of everything, and it's been actually really helpful. I've used it many times, and it usually guides me in the right way.
That's amazing. Well, we're going to come back to it because I feel like a lot of the other questions will give us more of a picture in terms of kind of what your journey has been like, and then we'll feed back into that, which is really great. Now, then, even as you obviously seem like a very structured person in the sense that you're taking into consideration multiple domains, multiple different elements. So let's talk a little bit then about the future, as you're even thinking about the future. So what's in your future? What do you want your legacy to be?
Yeah, that's a tricky one to answer without sounding too pompous, but I think in every job that I have done and in the job that I'm in, I would say one thing that I keep coming back to, even though the job tasks are different, the organizations are different, the thing that is at the core is that I keep sort of focusing on my work on trying to find solutions that can make life a little bit better for those women and children who live in the poorest billion people in the world, where poverty and health are so interlinked, and where making a small difference in access to health can make a huge impact on not only their health status but poverty level and ways to sort of survive. So I think that has always been at the center of everything that I try to do, and I hope that will be my legacy, trying to address that from different sort of chapters of my career, starting as a researcher, moving into academia, moving into NGO work, and now sort of UN related work. And I think that's always what I try to keep my eyes focused on.
Yeah, I like that. I feel like you also were very realistic in the sense when you said, and I kind of noted this too, and you were saying like the small impact. Sometimes we always think so grand, and even the small impact makes a significant difference, because a small impact on 1 billion people is a big impact, right? For sure. So that's great. And so let's talk a little bit more. So within this outlook, you seem also kind of very logical as to how you want to contribute, but how have your past and maybe present experiences really shaped this outlook for you? Were you always like this, or has that also kind of grown?
Yeah, I mean, it depends. This question made me reflect a little bit of where I'm coming from. I'm sorry, that is my cat who likes to join Zoom calls. So I come from a very I come from a farm. I grew up on a farm, which was very practical. You had to solve a lot of problems, right? And I think my dad was one of the best problem solvers in the world. So I kind of grew up always having to be taught to figure out how things were working and why things weren't working. And then in my family, we've all applied that in different areas of work. One part of the family ended up working with poor farmers and sort of using agriculture as a way of supporting, sustainable food production and organic farming. And another side ended up working in IT. And I think my focus was somewhere in between, right? And I think when I found out what I wanted to do was, I almost remember the moment when I realized it was going to be global child health. And I had always had an interest in understanding the science behind infections. I was studying pharmacology and microbiology and virology to really understand the intersection between health and germs. And I went on a trip to Nepal where I happened to travel with a friend who was a pharmacology professor, and we saw this little boy in a home where we were staying who had a nasty cut on his face. And all the family had to put on this really deep wound was toothpaste. And I remember really trying to understand the rationale behind it. And I remember asking, I was quite young at the time, and in hindsight, it was probably quite logical. If you have nothing, toothpaste can, have antibacterial properties. So it's not a bad idea. But that sort of made me start thinking about the importance of having access to just essential healthcare, simple things like soap and water to start with, and antibiotics and these things. So I think that's where it really helped shape me. That trip, I remember in particular, that I really wanted to go into this field more and understand better what we can do, the small things we can do to just make the basic healthcare available and affordable to people who have practically nothing.
Yeah. So on now a different note with regards to, your line of work, and I think in most people's line of work, right, there are challenges, there are obstacles, especially as you're trying to create change, no matter how big or small. Can you share some failures or challenges you experienced that maybe changed your outlook or now made you do things a little bit differently? And like anything you maybe wished again, this is not about regret, but maybe wished you would have done differently, or actually makes you think about doing something a little bit differently into the future.
Sure. I think maybe not a failure, but I think one thing that made me change my career path a little bit was, I started my professional career quite early. I went straight from school to do my PhD, basically, without no proper job experience. And so I spent the first probably 15 years of my career as a researcher. I did my PhD and then my postdoc. I was working in the university. And I was lucky because I had a chance to do this in collaboration with Ministry of Health in Uganda, with professors at the School of Public Health in Uganda in Makerere University. So I was exposed to people who really knew what they were talking about. And I was very lucky that they took me on. I spent my PhD collecting data in really remote communities where I was living on the border of the Congo. And but in hindsight, all those years, they were basically a strive to publish papers. You publish research papers, and so many of these, I've probably published over 80, 90 papers by now. And looking back, how many of those actually led to any change, and how many of those were even read, And I think at some point I got a bit frustrated with how much research we do that isn't designed for the people who need to use the research, or even in collaboration with the stakeholders, especially coming from, as a white, Northern Scandinavian woman, into the communities in Uganda, trying to do research on people's behaviors and so on. I felt that I was missing this piece to be able to actually do something and be able to change something. And I'm not saying research is bad in any way. I am a strong believer that we need research, especially we need this sort of on the ground research. But for me, at that point, I got a bit sort of frustrated with the fact that there was so much research being done and presented in big conferences with nobody from the actual, the beneficiaries from the countries even being invited to the table. And so that, I think, made me take my first sort of big turn in my career was when I had the opportunity to join an international NGO and work on research, be the senior the senior research advisor in an NGO that was also sort of implementing and deploying large-scale programs with the governments. And so that for me was sort of a perfect place to be, because not only were we doing research on real life problems, on real programs that were implemented large scale, and we were able to use the results to tweak the programs and work with the government to sort of come up with better ways of doing things. So I think that was sort of the first realization of where I wanted to be. And then what happened after that was I was offered this opportunity to work for UNICEF, which was started off as a research position. And in UNICEF, they have taken the research to even the next level, whereby implementation research is something that we support the countries themselves to do. So it's not even, you know, someone like me or other academics going down doing it in collaboration, but it's really us supporting the government to do it themselves. And I believe now that that's really so critical. It's so crucial to build that research capacity among the stakeholders who can help them understand which questions they can ask of their programs and how they can use their own data to make changes. So I think I've evolved my outlook on how the importance of research in the field that I'm working on to something where I think it can sort of, the level of impact it can have. And I'm saying this without, like, in fact, what I'm doing right now is almost a step away from all of that, because I'm not really involved in much research anymore at all. But I will probably one day come back to it. And if I do, I want to build on that. I want to really build that research capacity. That's where I think we need to invest if we're going to be able to sort of really use evidence to improve the situation, improve programs, make it more efficient use of resources. Then we need to train the right people to do the research and ask the right questions themselves.
Yeah, and we need to make the information useful, right?
Mm-hmm.
Not just create the information, which I think that is such a great example too of a challenge sometimes that's faced in terms of on the ground. Like, you could be doing the research, but like you said, I mean, those that are using it, are they even reading it? Like, and is it written in a way that they can understand, or they think is valuable, or that they think is, you know, beneficial, or that they can use, right? Because even among academics, I mean, some academic articles are very dense for even academics, like, let alone, you know, for those that are on the ground. And I love this approach, and the intentionality of reshifting of, like, the intention of the research is to create useful information to the communities of which it is researching or working with. And so I think that shift in terms of who is also part of being involved in that research is really great. So that's a prime example too of a big challenge that you can leverage in a new way, or not necessarily a new way, but a different way of thinking to use that. So yeah, that's great. I think that's something we definitely always think about in academia, right? The need is to always publish, but at the same time, you also want, you know, you want uptake on it. You also want to think about who reads it, not just the number of articles.
But unfortunately, you're not rewarded for that. You're rewarded for the publications and the impact factor of those publications. Yes. And those are usually publications that people don't have access to even on the people you have been researching with. But policy impact is something that isn't even recognized, you know, as a researcher.
Yeah, and it's always interesting. I always also hear about, like, the variety of communication styles, even that now academics have adapted to, not just, okay, even if you publish in a peer-reviewed journal where people have limited access, is there ability to also get the information out in different ways so that it impacts policy, so that people can use it. And so, yeah, that diversity has allowed for more diversity of thinking of communication styles beyond just what is traditionally done. Now, when you think about the future, what excites you? I know there's so many challenges and obstacles that you're working towards improving, but what excites you when you think about the future, especially now you're working towards a post-pandemic world?
Yeah, I mean, I'm excited that we are in the post-pandemic era. And it's probably, I'm going to try to say that without making it sound bad, but I am excited about all the opportunities that the COVID pandemic has brought along. And I'm not saying that in a way of understating the impact that the pandemic has had on people's lives and all the suffering it's caused and businesses going down. But what it has really done is it has had a lot of people reflect over what they want in life. First of all, what quality of life means, whether you want to live in a big city or not. And it's okay now to ask these questions and actually do something about them. But I think from a professional perspective, I think also the pandemic has brought a completely new focus on the need for universal health coverage, on the need for affordable treatment and diagnostics for people, not only in the low-income countries, but here in New York, here in the US. And it's not something that we really saw much discussion around before. We've seen this sort of, before COVID, there was less and less sort of interest in supporting health system strengthening, making sure that health services were functional. Donor funding became more and more fragmented and sort of focusing on very particular illnesses or population groups. But I think what we really have seen with COVID is how incredibly important it is to fund and invest in a holistic approach to health. And this comes from making sure that sort of a function of like having resources available to deal with a virus like this. And that comes from anything like treatment and diagnostics, like I mentioned, but also having running water in a health facility so that people can wash their hands. We go out with this, importance of washing our hands for 20 seconds, but so many places in the world don't have running water. And all of a sudden there's been this increased recognition of these basic sort of things that have been missing. And same with oxygen. We have been fighting for years to get more resources to make sure that oxygen is available, especially for young children. My background started in pneumonia management, and pneumonia is the biggest killer of children under 5. And what they need oftentimes is oxygen. And it wasn't there at country level, but now with COVID, oxygen is pretty much one of the most commonly used, treatments of COVID. And I think for, the investment in COVID is going to save way more lives in children because we get the basic resources available for once. And it cuts across, there's been much more investments now in, many countries didn't have the health workforce needed to not even detect the virus, but to give vaccinations. There's been this, mega effort to get the COVID vaccine out, and it has needed. There's the resources needed at country level are just enormous, and they weren't there, and they're still not there in many places. But at least there's a global push to strengthen this all over the world. And I do think that the opportunities that this will have for healthcare more broadly is enormous. And it's great if we do it right. And if we actually build on this wave of momentum that we have and now expand this and learn from this and use these investments wisely to also address all the other health priorities and struggle, the challenges that we have that haven't stopped because of COVID, especially within child and maternal health.
Yeah. No, that's a great point too. Even thinking about it. So one of my areas, right, is access to medications and like globally. And so I've never had as many in terms of such a short amount of time, conversations about the supply chain and understanding access and all of that to such diverse stakeholders too. It wasn't even just like your own little, like the fragmented circles or kind of the silos within silos of conversation. And so that was definitely an opportunity to just talk about it in general, right? To get the vaccine as a medication to all of these individuals can also follow the same realm of like, can we also improve access to these other medications that also need, and like you mentioned too, like the basics of like oxygen and like all of these other things. And so there is definitely momentum, like you said there. And so now it's the opportunity to leverage it in a smart way to also work towards the other health conditions that existed before and will continue also to exist in this post-pandemic world. So let's talk a little bit more about some maybe current initiatives that you're working on that you want to share with us.
Sure, and this is obviously very related to the COVID pandemic, but it was relevant even before. And I would say that, so that's my work as the Chief of Digital Health and Information Systems at UNICEF. We had our approach to digital health in UNICEF is really focusing on using technology wisely in the intersection, the intersection between health and technology is where you use digital solutions to address health priorities. It's first and foremost a way to use technology to improve service delivery. So it can be used to improve quality of care by providing health workers with the right information and tools. It can be used to increase demand or awareness among patients by giving them the right information or updates about their children's conditions. And it also generates the data that the world so dearly needs on, well, first and foremost, that's needed at country level, even at subnational, at district level, but also that the world needs to monitor disease trends in the world. But so the way we work with this in UNICEF is really trying to always come at it from a health priority point of starting. So what is the actual health problem we're trying to solve? What is the actual problem what is the data that these particular health workers need or stakeholders need? And from there, the decision is taken as, is digital the most appropriate, and how would it fit into existing health information ecosystems in countries? And I think the way UNICEF were engaging in this space before was primarily I would say it was primarily for engagement with people, young people in particular, making sure that they had available information on sexual and reproductive health, for example, or we used it for community health workers, rural frontline health workers who needed information and who could collect data on the communities that they were serving so they could follow up the right children at the right time. But with COVID, it has opened up a lot of new areas of working for us. UNICEF has been the main procurer and supplier of the COVID vaccine in the world. So we are one of the leads behind this COVAX initiative. And that means we have had to expand so much of our work in digital health to the immunization programs, especially the COVID vaccine program. And this cuts now across anything from logistics and supply chain management, cold chain monitoring. We have these freezers that need to be out there. We need to monitor the temperature of the vaccines. We need data and digital systems to register everyone who has been receiving the vaccine so they can be followed up and their second dose is registered. Some countries we have supported to also develop or to deploy the digital vaccine certificate so that they can open up businesses again. So all of a sudden, the menu of digital solutions that we work in within UNICEF has exploded over the last couple of years and since COVID started. And so the way we try to meet all this demand is probably the next sort of big excitement on my end is that we were able to start a new initiative that we call the Digital Health Center of Excellence, the DICE. And it came out of this need for having a mechanism in place to support countries with technical assistance for COVID, and in particular for the COVID vaccine rollout. We have a great group of donors, the big donors who support digital investments in countries. We meet every week and we discuss country coordination and making sure we invest in sort of either similar things or at least we don't cause too much fragmentation. But at country level, that sort of coordination doesn't always happen. And everyone is funding separate initiatives, different apps, and sometimes doing the same thing, and often resulting in very fragmented systems. And it's hard to do this right. Even in the Western countries, I come from Sweden, where I think we have over 300 medical record systems, and they don't talk to each other. Mm-hmm. And this is often the case for countries where there wasn't sort of a national approach in place beforehand, before this was all designed and implemented. And that's what we're trying to actually leapfrog and do better when we now have a chance to digitalize or digitally transform health systems in low-income countries and middle-income countries. So that's what this DICE mechanism is meant to do. We're collaborating, we're co-leading this with the World Health Organization, and basically set it up so that now we're actually very much focused on the 34 countries that have the lowest COVID vaccine uptake at the moment, and looking at how technical assistance across the board, not just digital, but anything related to their vaccine delivery, some of that can be supported through digital solutions. Often get requests around misinformation management, how to increase demand. We have a lot of vaccine hesitancy in a lot of countries. And there are some really great digital communication platforms and solutions out there that can be leveraged for this. And then we would come in and help provide that assistance to set that up. So this initiative has been incredibly laborious, been very time consuming over the last 12 months to get this going, but there's been so much excitement, not just within UNICEF, and that has kept us going and tried to sort of really make sure that we deliver on what we promised. And our hope is really that this will extend beyond COVID solutions, because it really is needed to have some sort of coordination and collaboration mechanism around this, to make sure that we invest our resources more wisely and support the governments to keep these solutions sustained and maintained over time.
Yeah, for sure. I'm just imagining too how amazing that would be as you start to also mirror it in a way. Each has to be unique in its properties and context, but for other disease states or other priority areas like you mentioned. But I can just imagine also how many challenges it would take, because like you mentioned, even in specific countries and communities, I mean, here in Chicago, like you might find like within certain neighborhoods and communities such drastic disparities, let alone countries across the globe that you're trying to have that. And I also like the distinction where you started with that health is first, and we're not just throwing technology at it. Technology is a way, like after we understand what it is that we actually need, because oftentimes, especially now in this world that we live in, technology always is like the first recommendation. We'll just throw some technology on it. But I think, especially as I hear you and knowing kind of the global health space it's not necessarily always the first solution at first, because it's like, do they have access to that? So really understanding where it plays a role, I think is a very significant part. But yeah, it's very exciting work that you guys are working on for sure there. So now let's talk a little bit about your own definition. So your own definition of success. You mentioned also early on that you also look at things both from a personal and professional perspective. So if you want, you can share on both, or, just talk about how it is that you define success, whether it be professionally, personally, or in general.
Yeah. I've had a lot of conversation. Fortunately, I have a coach at work. Someone from UNICEF was offered to me as sort of a professional coach to take me through this, to actually find a way to be successful without having to work 24 hours a day. So, and she has reminded me many times that my team will not be happier when I'm stressed and tired.
That's true. Very true.
And it's hard. I think the hardest part is to be successful in getting the job done, while at the same time taking care of yourself, making sure that you pamper yourself sometimes, daily, I would say, with enough, sleep and food and exercise. And that's been hard, especially during the pandemic. So I can't say I'm particularly successful at on both levels. But I still think that, to me, the more important part of success is to to see how the efforts you're putting in, resulting in some tangible impact for the people you're working for. And I think for me, the greatest level of success is when you see these actions being taken by stakeholders at country level who don't even know that you exist. You know, they might not have a clue that these ideas came from me or my team, but you know, the ball is rolling and it's taking off, and people that we are trying to influence are coming up with these ideas themselves because they've been inspired or influenced one way or another. And I think to me that is the best indicator of success, is when they think that they came up with this and they think this is the best way of doing things. And just to be able to be there in the background and sort of inspire those changes to happen.
Yeah, I like it because it built on also what you said earlier in terms of the importance of, you tied it like in terms of success with uptake and usefulness, like we had mentioned before, right? So it's like, well, if it is then successful, if they find use in the information, whether they get inspired by it or they build upon it to create something of their own, which is really interesting. Okay. Let's actually talk a little bit about creating environments for success. So you and like you mentioned, you can't work 24 hours a day all the time. So creating an environment for success means going beyond yourself. So what are some strategies you use to create your own environments for success?
I think it's about finding your allies, and they're not always in your team. Oftentimes, a lot of them are, hopefully. But I think it's also about finding allies outside your immediate job circle. So finding people who are influential, but perhaps working with a different organization or in a different donor, or, you know, with a donor or implementer who believe in the same vision and have the same ideas, because it's important to sort of ground truth and make sure that your ideas make sense, even though they sometimes are quite crazy and may not seem feasible at first. I think finding the group who backs you up and who can sort of be those people you can brainstorm with is really important. And then you can, at least for me, then I would sort of maybe dare to take that step forward to sort of break a bit of new ground. And I think it's also about trying to, I should say this without sort of upsetting people in the organization, but trying to find ways of doing things despite policies, because oftentimes we work in very bureaucratic settings, you know, and things are slow. It takes a long time to get things done. In a machine like the UN, you know, there is a lot of bureaucracy. And I think we need to be brave to be finding pragmatic ways of sometimes operating within those ecosystems and environments to get things done. Mm-hmm. And yeah, again, I think it's about finding the people within the organization who you know would excuse you if you overstep some of those boundaries, and make sure that they will back you up, even though you might not always follow the rules.
Yeah, because you're going towards something, which was kind of that metric of success that you're working towards, whether it's helping that community and then understanding all the little bit elements. And I like the examples that you're talking about in terms of even looking at your environment, just beyond even your immediate teams. You can still create an environment for success that builds upon that. And I think that probably also speaks a lot to your global health background, in the sense that, you know, you have to be creative about who you partner with, who you think about, who this impacts, who could help you, beyond kind of the traditional metrics of like, or traditional roles we think would be the suitable ones. And now too, within the pandemic, kind of the opportunity of more diverse industries too, thinking about it, that would even kind of necessitate that way of thought of saying, like, you know, who can we look on beyond that would work towards that mission and, you know, be the allies and that type of thing. So let's talk about leadership. I absolutely love your quote, by the way. So we ask our guest leaders a simple question on leadership. How would you describe a leader? You responded, leadership is overglorified and the real change always comes from the followers. When in a leadership position, you have to dare to be that one lone nut who has to dance alone in front of a crowd. But if you can do this in a way that is convincing and easy to follow, others will have the guts to stand up and join in. It is the followers that make a lone nut a leader. Can you elaborate on this and what's shaped this outlook?
Yeah, and I can't say I came up with this entirely on my own, even though I feel like it so resonates with me. I think this is a leadership quote that has kind of come from, actually everyone should watch this. If you go to YouTube and look for the lone dancer, I think it's called.
Okay.
It is so perfectly telling in how, as a leader, you often have to be quite brave, sometimes a bit daring to stand up and present a new idea. You might get shot down completely, and others might laugh at you. That's how I sort of link this to that lone dancer. It's basically a guy in the field full of people who stands up and just dances completely on his own. Everyone's looking at him, laughing, thinking he's crazy. But then there's that one next person who joins him. And then it starts a movement where it's almost too embarrassing to sit down because everyone is up dancing. And I see this, I think this is exactly how I think leadership should work. You have to be that person to stand alone on a stage, sometimes defending crazy ideas or taking the blame for maybe mistakes other people in the team have done. But if you can present those ideas in a way that they make sense to others and others might like how you're thinking, you will get that crowd who backs you up, who follows that sort of pattern of thinking. And in the end, you can kind of blend in and it's not just focus on you anymore.
Yeah. No, I loved it because I was imagining it kind of like, actually now when you're thinking about it too, with the whole crowd thing, because yeah, you forget then who was the first person that danced. Like everyone is then dancing, or everyone's kind of growing, and then it became, and then I love that definition too, because it reshifted the definition of the leader back away, because we talk a lot about good leaders in terms of, you know, it's not just about them. So that really did shift. So I just now kept thinking about the followers and like all the people and the elements of who it is that would follow this type of leader or this type of individual or who they mirror. So that's why I definitely loved it. But now, especially with the dance analogy, is so great because yeah, you do have to be the one that, you know, you are vulnerable. You might look silly, you might look incompetent, you might look, you know, to others, even though you're not. But I think that's really powerful for a lot of people, because then that takes courage and kind of trust that you would hope, or, you know, maybe others won't dance with you and you'll be on YouTube dancing alone.
Oh yeah.
So leadership is a big topic in general, right? Like everyone's talking about it. It's a buzzword and we hear about it a lot throughout our career. What do you think we're getting wrong about leadership though?
Well, I think coming back to that analogy about the lone dancer, I think we often get told that we all need to be leaders, but I don't think that would make a very efficient team if we were all leaders. An organization need like a few number of leaders who are able to inspire and motivate and be creative and come up with ideas. But, you know, it's more about how you create that crowd of doers. I think personally, I'm actually a pretty bad doer because I never see things through. I like to start things and and hand them over. And then I'll start something new and I start something new. And I think that's perhaps why I'm in this role. But that could only work if I had a team of people who were the doers and who liked seeing things through and then were sort of engaging over time with one problem or project or activity. So I think often organizations get this wrong in that they're not necessarily selecting the right people for the leadership positions, especially if you work in a field like, highly like a technical field, as I call it, an academic field, where, for example, we're hired because of our technical skills. I'm a, child health epidemiologist. I was hired because I know childhood epidemiology, but I then the career step, the career ladder is not technical. When you reach a certain level, the next step is managerial. And unfortunately, that's where technical people often end up, even though they might not want to be in that role, or they shouldn't be in that role because they don't have managerial skills, or they don't like the tasks of being a manager. And it also takes you away from the things that you're good at. So I think this is a shame, because if there was sort of career tracks that really rewarded your technical skill set, if you are an expert in a certain field, that's where ideally you should be able to climb. But that's rarely the case. I don't think I have worked in many workplaces where that is the case. And unfortunately, the next step up is to be a manager, and then you deal with admin and staff management and things like that. And I think, managerial skills, you're not born with leadership skills. They're a set of tools that you need to know, a set of processes and tools that make you a good manager. And they're not something you can just learn. I mean, you can learn if it's offered to you, but I think we often put people in the leadership role without giving them the tools and the skill sets, expecting them to do a good job.
Yeah. No, yeah, for sure. That's so great. It goes back to actually thinking about leadership beyond just the individual, and a good leadership style includes those that are the doers and beyond the leader as well. So what leadership advice or lessons can you provide to our current and future healthcare leaders, both men or global health, healthcare, public health, women and men at different stages of their careers?
I would say I can only speak from my own experience, but I observed my leaders a lot. And when I found someone in my workspace who was either my manager or someone else's manager who I respected and appreciated, I would study in depth, like really study their way of leading. It could be anything from how they were communicating, how they were responding to ideas, how they were managing conflicts. And I remember specifically a manager that I had in London who I was admiring his leadership skills. And I really made a point of trying to understand the way he was working. And there were certain things I didn't agree with. And I could sort of then reflect on how would I do this differently? And I would sort of internalize that a bit. So I think finding a couple of people who you can observe, and it could be bad leaders too, and really think about what is it that they're doing wrong that I don't like, and how could I do that differently?
Yeah, no, that's valuable too, because it gives you, some people are very hands-on and they want to see it out in practice, because sometimes some advice just seems like, okay, think about this, but until you start seeing that either mirrored in somebody, whether good or bad, I think it definitely, you learn from it differently. So I do want to get to some audience questions as well, but before we transition to that, we do like to take this opportunity to support one another and recognize the positive influence we have on one another. Can you name a woman who's inspired you, and why did you choose this person?
I think this was the most tricky question of all. And in my case, what I could come up with, who's probably inspired me the most from the very early days, is a Swedish author called Astrid Lindgren, and her character Pippi Longstocking. Pippi was a 9-year-old red-haired girl, very unconventional, superhumanly strong, and she was very kind. And she has inspired a whole female generation, not just in Sweden, but also elsewhere. And she made me go into activism when I was 5 years old, and sort of request our municipality to bring more Pippi culture to our town, and it ended up in the newspaper. But I think for me, and I'm not saying this as a sort of because I couldn't find anything else to think of, I actually think the literature that you expose young people to can be incredibly influential for how they shape their lives. And I I do think this author Astrid Lindgren, she's a, what should I say, a Swedish, one of the most famous Swedish people. She had a way of in all her books sort of empower young women. And I'm not talking, I'm talking children here, but it's stayed with so many of us, of how you can be independent, how you can still be successful, not successful necessarily as a child, but yeah, how it's okay to be a girl.
Yeah.
And I do think that this has really had an influence on me. I have not, unfortunately, had the chance to work with a lot of female leaders in my career. They have mostly been male, and they've been great. But that's why I really struggled to find sort of a real person to relate this to.
But that's actually fundamental. It's more also too with this question, when you also begin to realize what kind of influence this individual or this, this chosen individual had on the guest leader, because like you said, sometimes we don't even realize that it's some point in time, whether it's like when you're a child or even an adult, like you are influenced in different ways in different capacities. And I agree with you in terms of what you expose specifically children to can be very also empowering and can definitely leave a mark to what they hope to achieve as well. Now, for the audience questions, we always have this kind of general theme with a lot of our audience questions. And I think you are a wonderful individual to ask this question, especially with all of your experience within the global health space and diversity of communities and individuals that you work with, is, what are some advice or strategies that you use when you engage diverse stakeholders to make sure that you respect those communities that you work at, and then but also to create kind of that usefulness of the efforts that you do do.
Yeah, I mean, this is something I guess I do on a daily basis, almost, working in a very international organization with teams from anywhere from North Korea to Panama. And I think I've learned the hard way when I when I actually came in as a young 21-year-old PhD student. I thought I knew a lot about the world, and I was asking questions, and I was asking why things weren't working. And I think what I've learned is you have to listen more than you're talking, for sure. Coming into a culture or context that isn't your immediate sort of community, it's about observing and really learning about their situation and their systems, and then talking last. Like you have to listen to the reasoning and why things are working in a certain way, and if there is room to suggest ways of doing things differently, etc., then you have to be very careful how that's sort of inserted into conversations, because everyone has a reason for doing the things they're doing, and it's about being really humble and really respectful, and playing ignorant, like not even playing, you're recognizing that you are ignorant, and you're an outsider, and you're an observer, and what works in a country might work for a reason, and it might not be that what you think is the better way of doing things would work in that country or context. So I think for me, what I'm trying to do, and where I think I can be most helpful in talking to leaders, whether they are a community leader, a women's group leader, in a rural community, or a permanent secretary in a ministry, is to share my experience of how it's been done elsewhere, and just put it there. Well, this is what I saw in South Sudan. This is what I saw in Jamaica, and sort of, again, just plant the seed that things can be done differently. They can work in a different way, but you can never really push and sort of try to sort of impose your ideas on other people, and we shouldn't.
Mm-hmm. And then I think also the approach that you were talking about in terms of recognizing what you really do know and the majority of the part that you don't know adds that element of humility. And when people are humble and there's that humility element, they're easier to talk to, they're easier to trust, right? Like there's just that element that also builds up upon that. I do want to go back because there's always these questions about how do you prioritize and like what, where do you put your effort? You talked about kind of this matrix or this kind of way that you do. What, for those that are thinking about setting up their own systems to prioritize things, what do you think they should start thinking about? Not necessarily, because like in a space like yours, we don't necessarily always believe in the copy and paste strategy, but the general framework of when you're trying to think about what you prioritize and what you work on. Yeah,
I mean, I think I have some practical tips that I use, like how you manage your inbox and things. I don't want to go into too much detail, but we could spend 24 hours a day reading emails and responding to emails. And so I have a very efficient way of automatically filtering my inbox so that only the things that I really need to respond to ends up in my inbox. The rest I read when I can. And one way of doing that is to anything you're just copied on, we leave for another day. And then I filter. I always prioritize my team first. So when I come to work in the morning, because we work over many time zones, there will be like the inbox is full by 9 a.m. right? And so I always I search for the team members in my immediate circle, and I look at if anything's coming from them, because they are the doers. And if they get stuck because of me, then I'm holding them up. And then I probably search for my managers and see if there's anything coming in from above. But and it's important to be able to manage, especially with all this remote, home-based working, is to be able to manage getting things done to just responding and giving information takes up so much of our time. And when it comes to sort of then higher level priorities, again, there's actually an African proverb that I love, which is, when you're asked to look up, never lose sight on what's on the ground. And this, to me, especially in the field of digital health technology, there's so much excitement around artificial intelligence, blockchain, et cetera, et cetera. And it's all exciting and new, but we have these real life problems right now, which require much less advanced innovations or interventions. And that's why we need to work right now if we want to do something that is of impact. Either we can participate in those more sort of stargazing initiatives to a lower level or to a less extent, but it shouldn't take over what we do, because we have more concrete things to work on right now. So it's hard, because some of these things are really exciting, but the work we do is maybe more boring, but that's where we need to focus. And I'm quite structured. I have work plans, I have work, priority lists and so on. And I think that's also, those are tools that everyone need to work on, is not losing track of that to-do list for this week and make sure things get done.
Yeah. No, I like the approach to thinking about reducing the noise to focus on what you actually need to get done so that you can be in that doing stage is really powerful, so that you're not always just in the planning phase, which I think many people are. And then that's why they keep adding to that planning phase. And when they go to do, it just seems impossible because they're not in the doing phase most of the time. So anyway, we are at time. This has absolutely been so great. I've really enjoyed our conversation. Thank you so much for taking the time. Are there any other closing remarks or anything that you'd like to make before we close out this session?
No, just thank you for having me on this series. And it's been the first time in a very long time that I've had to reflect on any of these questions, and it's hard to be.
I know. I keep telling everyone they're simple questions, and they're telling me, no, they're not simple questions. But it is really good sometimes to just sit and reflect and think through about that, especially as we're kind of always in that action mode and thinking of that, because it really does inspire other people to kind of think about their own style and how they can also mirror in different ways of what they see. So thank you so much again. And for everyone listening, you're welcome to watch all of our other previous sessions on our website, and we have more to come. So thank you again. Have a wonderful day.
Thank you.